Thank you, Gloria, for that introduction earlier. Like she said, I'm Candace Shaffer, the Senior Director of Benefits. Been at Purdue for close to 7 years. So next slide, please. So just to give you kind of an idea of our landscape, if you're not aware, we are one of the nation's leading research institutions. We have 3 campuses and 4 locations. Very different needs. We also have, because we have the land, we are the land grant institution. So we have individuals in all counties in Indiana, and we have many states, but it comes down to 12,000 or so eligible employees in our inactive populations, and covers just under 25,000 total members. So as of January 1st of 2021, we did go 100% consumer-driven health plans as well. We did have a PPO plan in previous years, and we have removed that from the options. So, and then you can see down there, we strive to provide quality, affordable, family-friendly benefit offerings to meet our diverse workforce. So, and then we are, not afraid to kind of dig in and look at the different ways. Not only do we engage as an employer with healthcare, but how do our members engage, and how do we solve some of the problems that maybe Troy highlighted and some others. So next slide, please. So kind of taking you back a bit to explain where we got, where we are now and where we're going. Really back in 2014, we did make a major change with our medical TPA, got quite a bit of savings. And so we continued to kind of ride on those savings. We had minimal increases to our employees, but you can see that blue part was the university spend. And over the course of 4 years and not really doing much with our healthcare plans, the university ended up taking on an additional $30 million in those 4 short years. And so we did add a few benefits in 2016, but those were only projected to add a few million to our expenses. And so as that result, we started to dig in and peel apart where were the expenses coming from. And so we found different areas, as you would imagine, imaging, labs. We realized our on-site clinic at our main campus wasn't performing quite the way that we had expected it to when we opened the doors in 2013. Pharmacy, which we'll get into here in a second. Of course, hospital pricing, which continues to be a concern today, chronic conditions, and then other specific services and much more. So I'm guessing that doesn't really surprise many of you out there on what we were able to peel back when we started digging into the data. Next slide, please. So as we did that and we were digging into the data, we really started to make plans. And in 2018, we really started focusing on different aspects, primarily around wellness and total health, total benefits, which you can see there with the healthy boiler. And we have 5 pillars. I've highlighted the physical one because we're going to talk about our healthcare, but we have other areas that we look at: financial, behavioral, work-life integration, and social. But moving into the physical health space, and what could we do within our medical plans? And so we started to focus on what we call smarter healthcare. And as a result, we acted on many items that you see there on the right: administrative changes. We looked at our on-site clinic. We looked at the current contracts that we have and those ASO fees. We consolidated advisors. We were looking at concierge services, direct agreements for specific services, things like pharmacy. We've looked at narrow network options, and then of course our eligibility rules. So today I'm going to talk about some of our concierge services related to pharmacy, and then our direct agreements also related to specialty. Next slide, please. So it's a busy slide, so I apologize if you're not able to see it. I know the slides will be available online. But this is specific to our pharmacy expenditures and the trend. And so starting in 2015 all the way through 2020, You can see the blue section there is non-specialty. And then the orange is our specialty within our prescription plan, and the gray being our specialty spend within the medical plan. And we really do consider the specialty medications both in the pharmacy and the medical. Just to note a few things that was going on when we were making these expenditures. So in 2016, we did customize our specialty formulary with our PBM at that time. So you can see that trend. We saw a negative trend, or our trend go down in 2017. In 2018, we actually changed PBMs, and that did provide a $4 million save for, and that's a combination of employees and employer spend. But it was mostly on the non-specialty that you can see there on the graph. And our specialty trend only slowed in that year. In 2019, we did change our formulary with the new PBM, but again, we were quickly rebounding and surpassing our PMPM for specialty drugs. So especially in the prescription plan. Next slide, please. So further looking at it, we really wanted to change our focus and look at what could we do within both the medical and the prescription plan related to prescriptions. And so we dug in further. We met with our own College of Pharmacy. We met with our PBM, and then we also talked with other medication or pharmacy experts. And what we found is that we needed to look into the following things. We really needed to look at how members engage and whether or not they are taking advantage of any cost saving, whether they're notified or they're aware that they're out there. We want to focus on the right drug, right channel. We really do, a lot of this has been around cost, but it is also about quality. We want our members on the right medication that's going to help them either sustain their lifestyle or make it better over time, whether that or even in the short term. We really wanted to look at our prior authorization process and make sure that it was solid and high quality. Also looking at our formulary and making sure we were optimizing that. Managing the manufacturer assistance that Troy kind of hit on earlier. Also, did we have a high performing network? And do we need to make any changes? And then also dealing with our high cost case management. So as with many employers, we have a small part of our membership that drives a lot of the cost. And so how are we really helping them maximize savings, maximize outcomes and quality as well? So next slide, please. One of our first things that we did is we engaged with RX Saving Solutions. This is a free to the member service that alerts you, and they can register with RX Savings. They can select if they want to be alerted via email or text. We really like this service that we've added. We call it a concierge service because it's applicable for a lot of our members, with a majority of our members who take medications being more on the retail or mail order side. We knew that this could have a lasting impact to a lot of members. And so they can, again, they register, they can select how they get notified. And what RX Savings will do is provide them with that notification to say, you have a savings opportunity. And that might be a therapeutic alternative, a generic clone, a combination split. It can be optimizing the dose, or it can be a fulfillment change. So it could be, if you go 5 miles down the road to this pharmacy, you could save $5. Or it could be, did you know if you take this medication in place, whether it's from a brand to generic, you could save $10 a month, whatever that is. And so when they make that alert to the member and the member reviews it, the member can say, yeah, I want to learn more about this. I want to engage in this. And then RX Savings reaches out to the provider, talks to their provider about the opportunity. And then from there, if the provider approves, the switch can be made. And so the other way that our members have been interacting with RX Savings Solutions is there is a mobile app. and many of them will be in their provider's office being prescribed something, and then will look up that drug and have that conversation directly with their provider. So it doesn't even need to go through Rx Saving Solutions. And so, you know, there's a couple different opportunities for how they engage with them. Next slide, please. And I did want to share a couple of examples of some of our members and how they have saved last year. So this is one of our members, and she had migraines, and she received a notification via email. And so she did reach out to Rx Savings and learned more about the savings opportunity. Once she felt comfortable with what was being recommended, she gave Rx Saving Solutions permission to reach out to her provider. The provider did the same, learned about it, about the alternative. The provider agreed, and then they made the switch. And the provider kept in touch with the member to make sure that the switch was successful and that there weren't any adverse impact. And you can see here on the screen that a large part of the savings did, in this example, go to the university and to the plan, but the member also had some savings. Another example, I just don't have a graphic on it, was we have a spouse on our plan managing nearly a dozen medications every month. For the most part, the spouse reported that the cost of those drugs were manageable, but there was one particular drug that was over a third of the total cost every month. And Rx Saving Solutions reached out to that individual and talked with them about an alternative. It happened to be an eye drop. And so what they recommended was switching from the brand to a combination split into 2 eye drops. And so the member decided to do it. The provider agreed. They've made that switch, and that individual is saving nearly $1,000 a month now on those medications. So, you know, really a couple of good success stories. We have many more than that. So we've been really excited about this added benefit for everyone on our plan. Next slide, please. And this is just an example, you know, I think with this being that it's for a large, nearly every member on our plan can take advantage of this at some point. Communication and education has continued to be key. This is a sample of a mailer that we sent out to everyone to their homes to make sure that we were getting not only the employee, but getting at that spouse. It's sometimes we've learned from our members that it's the spouse at home that's managing prescriptions and medical costs. So we don't have on here the actual number, but it really is in the millions in regards to the opportunities for our members to save money. But it does come down to being partly their choice, and then of course their provider's choice, to make sure that the switch is appropriate for them. Next slide, please. So then moving forward into you know, our specialty and within the medical and prescription plan, we did, in addition, you can see in kind of the lighter gold, we've done some other direct agreements, but specific to specialty within medical and prescription, we have, starting in 2020, really hit those much harder and with much more focus. Next slide, please. And why, and I think, again, Troy, you hit on some of these things in your own presentation, but when we think about Purdue's plan, our specialty spend is, you know, 46% of the total dollars that we spend on prescription, but it's only 1 to 2% of the prescription volume. It's even, you know, 1% of our population. And so, you know, it's quite a bit of spend for, you know, few interactions. But with specialty drugs, a lot of them, the need is chronic. And so these medications are needed, you know, for years, if not forever. And so we really wanted to dig in and make sure if we were going to make a change, if we were going to look at this differently, we need to make sure we have quality adherence with outcomes. So better authorization process. Want to make sure that our members are getting the best site of care for their cost and comfort, which is great. And so we actually put out an RFP out for this in regards to, and this is specific to our medical plan at this point. And so we looked at, you can see there the criteria we used. So we wanted someone who had good qualifications and experience with CarveOut. We wanted to make sure their patient care experience was positive. And then of course, cost is always part of the equation. Next slide, please. So we started with our J-codes within our medical plan. We really did just begin with one prescription. We wanted to make sure that we were handling this in the best way possible. We wanted to learn from the experience. As we started this kind of journey and have continued on, we know that those individuals that are on, the J-code medications or other specialty medications are very astute users of healthcare, at least on our plan. And so they understand healthcare in a different level than a lot of our members. And so we needed to make sure that we were handling any transition that impacted them with care. We wanted to make sure we educated not only ourselves, but them about why and how that was going to happen. So we identified members, providers. There was communication both from Purdue and Archimedes, who we selected to help us with this journey. And we wanted to make sure that Archimedes was handling that member experience. We have, and still do, have weekly meetings with them. They went through the process of clinically reviewing everything, looking at those prior auths and what was going on. They focused on site of care to make sure that that was the most logical and convenient for the members, determined when we needed to transition. And then as we've done that transition, there's ongoing monitoring and reporting, both to us. Our members are very vocal, and so they are not afraid. I think with this first prescription that we did, I want to say that my team and I met with nearly all of the members that were impacted by this switch. And some was negative feedback at first, that we were able to take opportunity to make improvement as we've expanded this program. And some of it was positive. They liked the idea of some of the changes that were being suggested specifically to site of care. And so we've been excited to see that one drug, and now we've expanded since to more. So next slide, please. So to kind of show you some financial projections that we were making, the first drug we selected was Remicade. And so Remicade, if you're not familiar, is used to suppress the immune system for conditions like rheumatoid arthritis, Crohn's, and psoriasis. And so we were looking at, if appropriate, to move individuals to Inflectra, which is a biosimilar for Remicade. And so our projections, you can see here, this is based on what we thought we would spend in 2019, because we were, doing this before the year was complete, and applying the projected savings to 2020. So we anticipated saving there about $180,000 from 19 to 20. Next slide, please. And what you'll see here is our actual save. So after 12 months of implementing this, what you do see here is the employer and the employee save together. And it comes out to about a 32% save for year over year. So our 2019 actually ended up higher than we originally projected. We've also, in some of this save is in part, we had a change in our eligibility rules into 20. And so we did actually lose some Remicade members in that transition, and our headcounts have kind of shifted as well in 2020 as what somewhat expected with the pandemic. And so with that, we had a shift in utilizers based on what we had projected save and versus what we actually did. Although you'll see that the save coincidentally is nearly right on par with what we expected. Next slide, please. So being that we were successful with that medical carve out, and since then we've expanded. So every quarter we work with our medical TPA and Archimedes to carve out additional drugs. Again, we go through the review with Archimedes and with our TPA to decide which are the best drugs to do next. And then we transition those individuals each quarter. So, and again, the communication just starts, the whole pattern starts over. So, but being successful in the medical carve out, we decided we really should look at carving out within our prescription plan. And so, but with that, we wanted to do a little bit different. We wanted a full carve out. And so, again, an RFP, we determined that Archimedes actually was the best partner for that as well. And somewhat the process ended up being the same. It's just, it was with the pharmacy plan and not the medical plan. And so we coordinated with our PBM to do the carve out and to redirect any of those specialty inquiries to Archimedes directly. Prior to the year starting, which was January 1st, we did communication to those we knew we were disrupting, both from my team as well as from Archimedes. And we really were able to learn from the JCode carve out and the medical carve out and apply those things to how we approach the specialty. Because at one given time when we made this, it was a lot more members than it is when we do the medical on a quarterly basis. So next slide, please. So seeing as we've just started this carve out for 2020, you'll see that what here is what we've projected based on what we believe we would be spending in 2021, that just under 12 million, and then the projected savings, and then what we believe at the end of this year will be our end spend for specialty within the prescription plan, just over 9 million. This is based on 2020 enrollment and utilization. So again, any kind of shifts in that will obviously impact what savings that we've had. So next slide, please. This is just a summary of showing you the percentage of save on any of our targeted claims with these solutions that we've put in. So the RX savings solutions in 2020, we had a decrease of 2%. This is both employee and employer combined. We don't anticipate as much of a save in 2021, but we are, even though we don't anticipate that, we are going to continue to encourage registration, encourage engagement, and hopefully maybe we'll do better than what we project. And the Remicade carve-out, we saw those graphs, and that was a 32% decrease in that spend. And then the continuation of the JCode, we're going to expand that and what we anticipate this year with that impact, as well as the prescription that you saw. Next slide, please. So on the final slide, here what I'm showing you is just, at the beginning I talked about, we really focused on the pharmacy, but we've done a lot of things each year at Purdue to address all the different pieces of the puzzle around medical and prescription plans. And so what this is, I'll explain it to you again, another busy slide for you is, this is our per employee per year spend. The blue is Purdue's actual spend per employee per year. And then the yellow is, we used the published PricewaterhouseCoopers trend. And so what we've done in the yellow is we've applied that trend to Purdue's actual spend. And so what you can see in the gray at the top is that PwC trend year over year. And then you can see with the bar graphs what that yellow would do when we apply that trend to our actual spend. And so, but what we've been able to do with not only the pharmacy changes, but other changes is that orange line down at the bottom. So year over year, our trend has been 1%. And so, I only show that to you to say that it really wasn't, it's not all pharmacy. It really is all the different pieces of the puzzle that we're trying to attack kind of simultaneously. But it is working. And we use the feedback we get from our members, from my team, from our vendors, to make changes in subsequent years and make plans.